830 million people. Seriously, let that number just sink in for a second. According to the World Health Organization, as of 2022, 830 million people around the world are living with diabetes. That is a staggering jump from just 200 million back in 1990. We are looking at a condition that is scaling at an absolutely unprecedented rate, especially in low and middle income countries. It's a global health crisis and it's hiding right in plain sight. Welcome to our explainer today, where we're going to pull together the most vital information from the WHO, the CDC, the Mayo Clinic, and the NHS to give you a complete, comprehensive overview of diabetes in all its forms. To really grasp what's going on, I want you to think of the human body like an incredibly complex, high-performance engine. And unfortunately, unlike your car, it doesn't come with a standard owner's manual. Just like any engine, it needs fuel, it needs a spark, and it needs a delivery system to keep the whole shebang running smoothly. When we talk about diabetes, we're talking about a very specific mechanical failure in that system. Here's our roadmap for today. We'll start with what diabetes actually is, then break down the different types, look at the symptoms and serious complications, see exactly how doctors diagnose it, and finally, we'll cover treatment and prevention. All right, part one, what exactly is diabetes? Let's pop the hood and look at the baseline biology of our human engine. To understand the disease, we first have to understand how this system is supposed to work when it's perfectly tuned. Whenever you eat, your body breaks down most of that food into a sugar called glucose. Glucose is the premium fuel your engine runs on. But having fuel in the tank, or in this case, the bloodstream, just isn't enough. That fuel needs to get inside your cells to actually generate energy. This is where a hormone called insulin comes into play. It's produced by your pancreas, which is an organ roughly the size of a banana sitting right behind your stomach. Insulin acts exactly like a key. Without this key, your cellular doors stay locked and the fuel simply can't get in. So here's how things work when your engine is healthy. Step 1, your food turns into glucose. Step 2, your pancreas senses this and releases that insulin key. And step 3, the insulin unlocks your cells, letting the glucose in so your body gets the energy it needs to move, think, and breathe. It's an absolutely beautiful, highly coordinated chain of events. But with diabetes, this precise coordination totally breaks down. If the pancreas doesn't make enough insulin, or if your cells just stop responding to the key, those doors stay locked. The engine basically gets flooded with fuel. This leads to a state called hyperglycemia, which is really just the medical term for high blood sugar. The glucose just builds up and circulates endlessly in your bloodstream. And as we're going to see shortly, that causes massive damage to the body's internal plumbing over time. Moving right along to part 2, the different types of diabetes. Because an engine can fail to process fuel for a few different reasons, doctors categorize diabetes based on the root cause of the malfunction. And the contrast between the two main types is pretty stark. Type 1 is an autoimmune condition. For reasons we still don't completely understand, the body's immune system actually attacks the pancreas. The factory is completely destroyed, so zero insulin keys are produced. This often starts in childhood, and honestly, you can't prevent it, but then look at type 2. Here, the pancreas is usually still making insulin, but the body has become insulin resistant. The locks on the cells are jammed. The keys just don't work well anymore. What's absolutely crucial to understand is that type 2 accounts for over 95% of all diabetes cases globally, and it's heavily driven by genetics, weight, and lifestyle factors. Now, you also need to know about two other critical conditions. First, prediabetes. This is exactly what it sounds like. Your blood sugar is high, but not quite in the danger zone yet. Think of it as the check engine light blinking on your dashboard. It's an early warning state that you can often completely reverse with lifestyle changes. Then there's gestational diabetes, which happens during pregnancy when the body just can't meet the massive demand for insulin. It usually resolves after birth, but it acts as a huge red flag, but the mother and potentially the child are at a much higher risk for type 2 later in life. That brings us to part 3, symptoms and serious complications. So how do you even know if your engine is flooding with glucose? Well, when your blood sugar is way too high, your kidneys go into absolute overdrive trying to flush it out. That causes a chain reaction. You experience frequent urination, which leads to severe thirst in a dry mouth. Since your cells are literally starving for fuel, you'll feel intense fatigue and maybe even experience unexplained weight loss. All that sugar also pulls fluid right out of the lenses of your eyes, causing blurred vision, and it messes with your circulation, meaning cuts and sores heal incredibly slowly. Now here's the kicker. In type 1, these symptoms hit you fast and furious. But in type 2, they can be so mild that people walk around with the disease for years without even having a clue. And that silent progression is exactly what makes it so terrifying. Take a look at this striking data point from the WHO. 11% of all cardiovascular deaths worldwide are directly caused by high blood glucose. Excess sugar in the blood doesn't just sit there doing nothing, it's literally corrosive. Over years and decades, it actively damages the walls of your tiny blood vessels and nerves. The reality of unmanaged diabetes is honestly sobering. It sets off severe, cascading consequences throughout your entire body. Damaged blood vessels in the eyes lead to diabetic retinopathy and even blindness. Kidney damage leads to kidney failure. Plaque buildup in your major arteries triggers heart attacks and strokes. And nerve damage in your extremities, paired with terrible blood flow, can lead to foot ulcers that, tragically, often require amputation. It's a complete, system-wide breakdown caused by a poorly maintained engine. All right, moving on to part 4. How exactly is it diagnosed? Thankfully, identifying the problem before those awful complications happen is remarkably straightforward. Doctors use standard, really inexpensive blood tests. A fasting blood glucose test checks your levels after you haven't eaten for 8 hours, which gives a solid baseline. A random test just checks it at any given moment, but the absolute gold standard here is the A1C test. This doesn't just measure your sugar right now, it measures the percentage of your red blood cells that have sugar-coated hemoglobin. And since red blood cells live for about 3 months, the A1C test gives your doctor a perfect 2 to 3 month historical average of your blood sugar. It's the ultimate long-term engine diagnostic. And finally, part 5, treatment and prevention methods. Now for the most empowering part of our explainer today. Because knowing the mechanics and the risks is only half the battle, right? Let's talk about how we fix the problem, maintain the engine, and even prevent the malfunction from ever happening in the first place. But first, we have to acknowledge a massive global hurdle. According to the WHO, back in 2022, a shocking 59% of adults over 30 living with diabetes did not take medication for it. That means more than half of the people diagnosed are just leaving their engine completely at risk, mostly in low and middle income countries where treatment is hard to get. A diagnosis without action doesn't stop the damage. Active management is absolutely essential. And managing diabetes isn't a quick fix. It's a continuous long-term journey. You've got daily habits, like monitoring your blood sugar and taking your prescribed medications. You've got weekly habits. The CDC and WHO highly recommend at least 150 minutes of moderate exercise a week to help your cells use insulin better. And you've got yearly habits, like those crucial comprehensive eye and foot exams to catch any of those long-term complications early. It's a lifelong maintenance schedule. Think of medical treatments as your mechanic's wrenches. They're specifically designed to help regulate the body's glucose levels. If you have type 1, your body makes literally zero insulin, so synthetic insulin injections or pumps are completely non-negotiable. They're life-saving. If you have type 2, your doctor might start you on oral medications like Metformin, which lowers the amount of glucose your liver produces and helps your body use insulin a lot more effectively. And over time, type 2 might also require insulin therapy as the condition progresses. But guys, the most incredible takeaway from all of our clinical sources is this. Type 2 diabetes, the one that makes up 95% of all cases, is often entirely preventable. You are quite literally in the driver's seat here. Maintaining a healthy weight significantly drops insulin resistance. Eating a balanced diet and cutting out processed sugars and saturated fats stops the flood of excess glucose. Staying physically active forces your muscles to just burn up that glucose for energy. And not smoking protects those already vulnerable blood vessels. These aren't just polite suggestions. They are proven, highly powerful lifestyle modifications. So we've covered the biology, the risks, the diagnostics, and the solutions. The science is incredibly clear, and the medical tools to prevent and manage this condition are available right now. The power to keep your body's engine running cleanly and efficiently is largely in your hands. So, knowing what you know now about the 830 million people affected globally, what proactive steps are you going to take today to protect your health for tomorrow?